This is my audience for my speech. Imagine living your whole entire life healthy and being able to hang out with friends and family, and then imagine being told that you have cancer. Now imagine it is one of the rarest and most aggressive types of cancer there is. Now imagine having to put your whole entire body, mind, and even your family through one of the hardest treatments to a disease today. AML, or acute myeloid leukemia, is an extremely quick-moving cancer that attacks the body at an alarming rate. It attacks the production of normal blood cells in the body's bone marrow. Treatment for this is an incredibly hard process due to the destruction of the body's immune system, high risk of complication, and the effects and damage it has on the body. So to begin, during the treatment for AML, there are multiple different ways to go through different kinds of treatments, but today I will discuss a common one, which is a stem cell transplant. So according to Macmillan Cancer Support, during transplant, you receive all new cells. The stem cell is one of the earliest stages of development in the body's cells found inside the body's bone marrow. All cells develop from stem cells, making them extremely important to the body's immune system. So during this, whenever you receive all new cells, your body is completely shut down. It's so incredibly weak that it results in everybody around you having to be around you in extreme caution. For example, anytime a visitor comes into a patient's room, sheets, pillows, anything that they've touched, anything the patient has touched must be changed and disinfected and thrown away. Even if the visitor has had a mask or they have all their vaccines or anything like that, if not, it'll result in a high risk of the patient getting another disease or eventually dying. Reason number 2 is that there are many complications. According to NHS UK, which is a group publicly founded healthcare system in the United Kingdom standing for the National Health Science, patients may bleed excessively, stating that you might bleed, bruise because of the levels of platelets, which are clot-forming cells, in your blood. Bleeding may be excessive. So, for example, this can result to bleeding in your skull, which can cause headaches, stiff neck, and vomiting, and multiple other complications. Another example is your lungs and your stomach. Your lungs, you can end up coughing up blood, have really bad breathing difficulties, and even have a bluish skin tone. And then for your stomach, it can result in you vomiting lots of blood, and it is also very common for there to be lots of gallbladder issues in AML cases, which can cause extreme constipation, gallstones, and which will result in having to get your gallbladder taken out, but you have to do it after treatment. So then it makes the treatment an extremely longer process than normal. And then finally, it causes extreme damage to the body after and during treatment. There are multiple side effects to be had on the body. One of these being is a cognitive change. So according to Cancer Research UK, one of the biggest things is cognitive change. So a lot of people notice changes in their memory, concentrations, and the way they think. These changes are called mild cognitive impairment or cognitive dysfunction. And then with this, these things include memory loss, confusion, and trouble concentrating. So not only are you putting your body through something so hard, your mind still has to adjust, and even after treatment, you don't feel like yourself all the way. So while the diagnosis of acute myeloid leukemia is extremely difficult, the treatment is just as hard for these patients. Thank you.